Good morning, people.
Good morning matako yako.
Okay, thank you. Okay, so we are beginning in a minute. Let's try to settle in. Let's try to settle in. We are beginning in a minute. Okay, so we'll get started. So we looked at the possible ways in which one can undergo a HIV test. But now let's look at when is it the best time for you to undergo a HIV diagnostic test. So the ideal thing is you should be tested regularly. Okay, you should be tested regularly, especially when you are sexually active or when you are working in an environment that potentially exposes you to the risks. So the best time for any person to undergo a HIV test will depend on several factors. Okay, but the major situations that will always point that you need to undergo a test is after there is a potential exposure. So possibly you've had unprotected sex with someone whose status you don't know. Okay, so it's possible that, for example, that person could be HIV positive. So if you've had a potential exposure, either through unprotected sexual intercourse, if you are someone who uses drugs, okay, maybe you shared a needle or something that cuts, something that is invasive, you shared such a thing, then you need to undergo a HIV diagnostic test. Possibly you've been raped, okay, you've been raped. Then you have to undergo a HIV test. So why is it important that if there is a potential exposure, you need to undergo a test? One, so that you can determine whether you are infected or not. Because when you are infected, then now you need to put in the medication bit. You need to begin taking the ARVs. You need to be enrolled into the treatment bit of the virus, because the earlier, the better. If you delay too much, then it will lead to serious health issues. But if you've had a potential exposure, undergo or take the PEP medication, the post-exposure prophylaxis. Post-exposure prophylaxis, okay? So after that potential exposure, take the PEP medication, which in the event that whoever you had that exposure from was positive, then the PEP, the post-exposure prophylaxis, might help you so that you don't eventually get to have the infection. So the first thing you need to do is, after a potential exposure, even before the test, meza PEP kwanza. Okay, let the test and reporting to police and other things come second. Because with the PEP, it is more about the timing. Mnasema mapema ndio best. Okay, so with the PEP, with the post-exposure prophylaxis, the earlier you do it, the better. But sasa usifanye kama njugu, that when you expose yourself today, unameza. Tena unaji-expose, tena unameza. That should not be the case. Okay? It's supposed to be an emergency thing. Sio tu ile unajua, I'm sleeping around with the people whose status I don't know, but nameza PEP, because PEP is not a guarantee. It only increases the chances that you might not suffer from the infection, but it does not make you to be 100% sure that you will not be infected. Okay, so after potential exposure, get the PEP medication, then go for a HIV test. Okay, get the medication, then go for a HIV test. The second situation that you need to undergo a diagnostic test is do it as part of regular health checkups. Okay, do it as part of regular health checkups. Because you need to know, it's encouraged that at least let's do it once or twice a year. Okay, especially if you are sexually active with the multiple sexual partners whose status you don't know. So you just make it part of your regular health checkups. So you could decide, maybe unapima mwezi wa 4, then utapima mwezi wa 9. So those are 2 times every year. But the most important thing is, as you go doing the diagnostic tests, you also have to ensure you are living a life that ensures you are not being exposed. Okay? So because if you continuously live a reckless sexual life, then it doesn't matter how many times you undergo the diagnosis. You just at some point expose yourself. Then the third one is during pregnancy. Okay, so as part of the prenatal screening, when pregnant women go for clinics, it's part of the requirement, because in the event that the pregnant woman turns out positive, then they have now to put in mechanisms to prevent the mother to child transmission of that HIV infection in the mother. Okay. The other thing is when you are planning to get pregnant, because for you to get pregnant, then there has to be no protection during the sexual encounter. So it means both of you, the people who are going to engage in the sex act, must know the status of each other. Okay, so that you don't transmit the virus to your partner, but most importantly, you reduce the risk of transmission to the child that you are planning to have as a couple. Okay, so when you are planning for that for a pregnancy, then you have to ensure that both of you. So for that case, it's not about the mother. the mother is tested upon pregnancy. But before pregnancy is incumbent on both of you, okay, to try and have that test done. So you know the person you are going to engage with. The other thing is if you see some of those HIV symptoms. So maybe you just begin to have unexplained weight loss. You have fevers, you have night sweats, your lymph nodes begin to swell. You have some chronic diarrhea, okay? So if you have, you begin to portray some of these symptoms, then you have to undergo a test. Why is it important? So that you either rule it out or you detect early enough that you are positive. Because after that, then now mechanisms to help you live a positive, healthy life will be put in place. So anytime you portray some of these symptoms, HIV-like symptoms, then you need to undergo a HIV diagnostic test. Then for the high-risk individuals, we have the people who do the men who have sex with men, people who inject drugs, sex workers, for example, the discordant couples where one partner is HIV positive while the other is HIV negative. So for that, for the discordant couple, it's important that they keep monitoring so that if there is a possibility that the HIV negative partner has been infected, then he or she can now be enrolled onto the ARV treatment. Okay. So why we say men who have sex with men, they have a high risk more than even the heterosexual couples, is because if a man is having sex with another man, then the man who is sort of the woman in that relationship will have intercourse in his anal area. Okay. So when you check the lining, when you check the thickness of the lining of the vagina and the anal area, the thickness of the anal area is extremely thin because what happens there is a lot of absorption of water. So the lining must be very thin so that water can be absorbed, okay, from the waste before you eventually now pass it out during ejaculation. So with that, then it means when there is any sexual encounter or any abrasion in the anal area, there is likely to be more rupture, okay, than it will happen in the vaginal intercourse. So then it means for people who have anal sex, chances that there will be a lot of breaks, a lot of abrasiveness, then we end up with so much of cuts will be at a higher level. Once those cuts happen, then fluids can now penetrate and enter into the people who have had that encounter. But for the females, so long the heterosexual encounter, so long as the woman is aroused properly, then chances that there will be cuts, chances that there will be a lot of abrasions in the vaginal area are very minimal. Okay, they are very, very, very minimal. So that is why initially when HIV had just begun, walikuwa wanasema ni ugonjwa ya people who do gay, because it was so high among the gay couples. It was so high. Okay, and that's the main reason. Okay. The other reason is for you to undergo a test is when you are changing a sexual partner. Okay, I don't know if most of you change or you just increase numbers. Maybe you have one, then unaongeza mwingine. Okay, But if it happens that maybe you've now just gotten a new either girl or boyfriend, it's important that both of you know the status of your new, what you guys like calling your new catch. You need to know the status of your new catch, okay? And once you've known the status, if that person is HIV negative, for example, then you have now to encourage each other to ensure that you maintain the negative status for both of you. Okay. But there are cases where you can unapenda mtu only to realize he or she is positive. Take precautionary measures, use condoms. We'll see measures on how we can protect. Okay. So how soon after the exposure should one test? There is what we call a window period. Is what we call a window period, but that is mainly if you are using the tests, the rapid tests. Those are the most common diagnostic methods. When you go to a hospital, for most of the visitees wanatumia the rapid HIV kits. Okay, so for them, if you are using that, then it can take even 2 weeks before the HIV infection can be detected. So it means then, if you went in for this, zenye unapimwa wanaweka kakitu alafu laini zinatoka mbili. If you had an exposure today and went for the test tomorrow, you will likely post what we call a false negative. Even if you are infected, you will post a false negative because you are positive, but now the antibodies cannot be detected yet because the kit is only able to detect them after around 2 weeks. So it means when you undergo a test for an exposure ya jana, if you use the rapid kits, then you don't get the clear result. Okay. The standard blood tests, the ELISA, the one reported here is the traditional one, but we have a modern one, a modern ELISA, which now checks for the presence of the proteins created by the virus inside your blood. That one is as sensitive as 2 hours. Okay, so when you are going in for a test, the results you get are not necessarily definitive. Haziwezi kukwambia kama umetumia tu hiyo kit, kale wanakwambia laini ikikuja hapa ikikuwa 2 utakuwa positive. That thing can give you a false negative because what you are looking for in the blood has not manifested yet. But if you go in for more sensitive tests, then you can know even after an exposure within even 1 hour. With the modern kits, that one we can. Okay, so I will not bother you too much, but all I will tell you is there is a window period. So after the potential exposure, it is not that ukienda tu kupima, ukitoka tu kwa section counter na uende upime hapo, utajua if you have it or if you don't. That's why it's important when you've had a potential exposure, you begin the post-exposure prophylaxis. Okay, take the post-exposure prophylaxis so that by the time, if at all you post a false negative, the PEP will be dealing with the virus so that it doesn't get incorporated into your body. Okay, but if you went in for a test 1 hour after the section counter, vitu ya kwenda kuambiwa ikikuwa red 2 uko nayo, hiyo utaenda utaambiwa hauna. Then if you are now not taking the PEP, the possible thing is that the antibodies will eventually become present in your blood after a week or two. So when you go back for the test after 1 week, after 2 weeks, you realize it's now positive. Okay. So after a potential exposure, the best thing you do, begin PEP. Then, depending on the availability of resources, you choose a diagnostic method. Okay. But you've now undergone a HIV diagnostic test. There are just two outcomes. One, it's possible that the test will turn out negative. That's what most people go hoping it will be. Okay, so what if you've undergone the test and the results returned indicate that you are negative? Okay, so if that is the case, then the desire should be for you to remain negative. You had that exposure. Okay, you shared a needle, you had unprotected sexual coitus with someone, but then after you underwent a test, after the possible window period with respect to the particular diagnostic test that you've chosen, the results return as negative. Sasa hapo lazima uanze kuweka bidii to not repeat what led you to expose yourself. Okay, if you went in and had unprotected sex, what now you need to do going forward is you need to ensure that when you're having coitus with someone whose status you don't know, there has to be consistent and correct use of condoms. Okay, so it is consistent and correct, because you can use it consistently, but not in the correct way. Okay, so condoms is just a barrier. The other day during Valentine's, nikipita kwa gate, I saw walikuwa wameandika ati no love bila glove or something like that. Okay, so a condom is just a barrier which is preventing contact between two people at their point of sexual contact. Okay, so it just prevents the transmission, the exchange of fluids, either from the male into the woman or vaginal fluid exposing to the man's reproductive organ. Okay, so they are just preventing that exchange, be it of semen, be it of vaginal fluid, be it of blood. And we saw that some of these bodily fluids, they are the ones that are so rich. If someone is infected with most of these STDs, then they will be so highly concentrated in these fluids, either in semen, in the vaginal fluid, in blood. So when you put in now a barrier to ensure that the fluid from one person does not get in contact with the other person's body, then you are likely to stop any possible infection. So the best way, the best practice with condoms is always use one condom during any type of sexual activity. So be it oral, be it vaginal, be it anal, let there be a condom used. One. So after the sexual encounter, after the ejaculation, you replace the condom. Okay. So you have to ensure that the condoms are properly used. Check the expiry dates. They should be stored correctly, and they also have to be used consistently. Usually the most difficult thing to do is for you to continue using a condom with your girlfriend whom you've had for the last God knows how many months. Okay. If it is possible that you know each other's status, health status, and both of you are faithful to each other. Okay. Both of you are faithful to each other, and equally, you are aware of the safe days. Because remember, condoms don't just protect infection of the STIs, they also protect pregnancy. Okay. So if you've known the safe days, if you know the health status, and both of you are sure that you only have sex with each other, you don't go around testing diversity, then at that point you can now say, maybe let's not use. But if you are not sure, then ensure that you always use condoms. If it turns out again that the test is HIV negative, then try as much as possible. If you now want to continue being sexually active, try the PrEP, the pre-exposure prophylaxis. So this is a daily pill which is taken by HIV negative individuals to reduce the risk of acquiring HIV. So it is taken by people who are in a profession that makes them to be at a higher risk of acquiring HIV. For example, maybe you are a nurse na unazalisha wagonjwa, unazalisha watu. You work in a maternity, okay? Or even surgeons, okay? Or even people who work in blood banks. Because by nature of the work, chances are that during ukizalisha mtu, you can have an encounter with the fluids za mwili ya huyo mtu. During a surgery, it's possible that blood could splash. So depending on the nature of your work, if you are anticipating possible exposure, then you can take some preventive medicine, a pill that will help you. So if it is taken consistently, it is fairly effective in preventing transmission. Okay. After the exposure, then you can try the PEP, the post-exposure prophylaxis. Then if your test was negative, another thing you need to do is you have to continuously have the regular HIV testing. Remember, there was a window period. Okay, so if you've tested 1 month after the encounter, if you are not changing your behavior, then now you have to ensure that you keep testing so that you know your status, which will now help you make an informed decision. When you've turned positive, for example, then you know the type of decision to make. So it just ensures that you are aware of your status so that you can always take any immediate steps necessary. Okay. So if you are continuously negative, then you continue with the practices you are putting in place to prevent yourself from the infection. If it turns out at some point, it initially turned negative, but then as you continuously test, you realize you are positive, then now you can know that there is medication which can help in treating. There is no cure for HIV, but there is treatment. So you can enroll to the antiretroviral therapy, the ART. So you have to continuously get tested, especially if you're having some very high risk behavior. You need to continuously undergo the testing. The other thing is you have to reduce the number of sexual partners. So if you are having several and you've underwent a test, then you realize that by God's grace, you are negative. You have to reduce the number and ensure that you remain with the people who are also faithful. You can reduce wewe ukuwe na mmoja, lakini huyo mmoja wako naye hana wewe peke yako. Okay, so both of you, you need to have a candid just discussion. Then you agree that if we have to ensure that we keep negative, then it's just the two of us in this section counter. If not, then now you have to go ahead and put in the preventive mechanisms. Because by doing that, by reducing the number of sexual partners, you are reducing the likelihood of encountering a HIV positive person. Okay, you reduce the likelihood of encountering a HIV positive person. Okay. So the best practice is you have to engage mutually in a monogamous relationship where both of you are HIV negative, or you are consistently adhering to antiretroviral therapy if at all one of you is HIV positive. Okay. So if it ends up that you are HIV negative, then both of you have now to adhere to the preventive mechanisms. Be faithful, use condoms, use the PrEP. Okay. But if it turns out, because the reality is HIV is with us, so you can go for a test, then you realize one of you is positive. So what do you do in that case? You now have to be consistent in the use of the antiretroviral therapy consistently, so that the one who is negative is not infected. Then, of course, what you need to do again, so that you are sure kwamba utabaki kuwa HIV negative, is you limit or avoid the high-risk behaviors. So the high-risk behaviors is sharing needles, having so many other sexual encounters without protection, or having unprotected sex with someone whose status you don't know, or engaging in a sexual encounter under the influence of drugs, na pombe. Okay. So you might have realized people who take alcohol, you go to a pub, ukifika kama hujaanza kunywa pombe, I don't take alcohol myself, but people will always say, ukifika hapo, you will not see any beautiful woman. But ukianza kunywa, then the ones who are there all of a sudden they become very beautiful. Okay. So what is happening is your ability to render a judgment is being compromised. So kama umelewa, you will not, for example, be so keen kujua tumetumia condom ama hapana. Okay. So you avoid getting drunk and indulging in sex at the same time, because then your level of judgment will be impaired. And at that particular point, you will not be in a position to ensure that you've put in the required preventive measures. Okay, then if at all you have a partner who is HIV positive, encourage them to enroll on treatment. It is possible that even if one is infected, and if that person enrolls and observes consistent and effective antiretroviral therapy, then they will achieve a point where the viral load, the amount of virus in their blood, will be undetectable. Okay, so that person is still HIV positive, but wakiangalia the number ya virus kwa damu yake wanaona haiko. So at that particular point, that person cannot transmit the virus to the partner. So it means then you can be actually in a relationship with someone, even if that person is HIV positive and yourself, you are not. So all you need to do is encourage that partner to undergo and observe the ART, the ARVs, aende consistently akitumia. Then itafika mahali, the virus itakuwa haionekani kwa damu yake. Then at that point, you can actually be encouraged. Mukitaka kuzaa mtoto sasa mnaweza mkazaa at that particular point. Okay. We've seen, we've largely seen what you need to do when you want to stay negative. Okay, so one, you have to use condoms consistently and correctly. Two, you use PrEP, okay? If you are at a high risk of exposure, then you use PrEP immediately after a possible exposure. Then you need to get tested regularly so that you know your status. Then the other thing you need to do is you limit the sexual partners and engage in just a monogamous relationship. Okay, because that is now avoiding the high risk behaviors. So you limit, for example, needle sharing and protected sex with people whose status you don't know. Then in the event you have a HIV positive partner, ensure they are on ART. Okay, then you can get vaccinated for some viral infections, especially hepatitis B, because hiyo usipokuwa vaccinated, kuna venye inaendeleza uwezekano wako kuumia na hiyo with your sexual practices. Then if you use drugs, hii ya kujidunga, you now need to practice safe needle use. Tumia tu a needle kwako, but msikuwe muna share na watu. Ati wewe unatumia, unapeana, mwingine anatumia, hapana. Then the last bit is you have to stay informed. Okay, you have to stay informed and involved in the community HIV prevention efforts. When you are involved, then you get to meet other people. Then you get to be told maybe what you know or what you don't know. Then now in the process, jointly, you can now ensure that it's not just you, but even the entire community is living a healthy life, even in the presence of HIV. But we've talked about preventing HIV transmission. So what are the most common ways in which HIV prevention can happen? So the most common way, even at the university here, we have these points where you find condoms are being given, okay? During, I think, a day to Valentine's, condoms were all over. They were giving them out. Of importance is to realize that now we have both male and female condoms. So they are among the most accessible, the most affordable, and is also among the most effective method if used correctly. Because as we said, they just create a barrier. So once that barrier has been created, then the exchange of bodily fluids is prevented. If the bodily fluids are not being exchanged, then possibly there will be no transmission. The only challenge we have is when you are putting on a condom. But now you guys these days, you want to do all manner of things. So you've put on a condom, but then you still want to suck the private parts. Okay? Because the whole idea of putting on a condom was to ensure that there is no fluid. But now you are busy sucking. You are busy sucking the breasts, yet you had put on a what? A condom. So then the work of the condom there, itakuwa haina kazi. because possibly you've already gotten the fluid exposed. Umeipata orally. Okay, so when you are putting on a condom, then you have to ensure that any other way in which the fluid from your partner can get into your body should also be avoided. Okay, should also be avoided. So why is it the condoms are effective, but why is it that now most people prefer using condoms? One is the ease of access. Okay, so for example, in Kibabi, the easiest way for HIV prevention is condoms. Because now if we told people of your age to abstain, it will be a bit difficult. So the easiest is provide condoms so that when people still want to engage in sex, at least they have a choice to do it safely. Then the other reason, there is dual protection. So they not only prevent an STD or an STI, but they also offer protection against unintended pregnancies. Okay. Then convenience, because they are easy to carry. You can put it in your pocket. Na mtu hatajua umebebana na condom. Okay. So you can, it's so convenient that you can carry it with you. And even the female condoms, you know, what we realized earlier on, the burden of protection was largely male-driven. So you'll find a woman who wants that people use protection. But then, before the female condom became available, it was the role of the man, because the only condom that was there was a male condom. So most male then will not have the condom. So you end up against the will of the woman, engaging in a sexual encounter without protection. But with the female condom, a woman can carry the condom herself and even put it on. So that it is now herself doing it. So the man does not participate in the decision whether you are putting it on or not. Okay. So the idea of convenience is both. It's easy to carry, but now it has also allowed women to participate in the decision making. Okay. So talking about condoms still. So what is the best way now to use these condoms? Okay. So the first thing you have to do is you check the expiry date. That can be found on the package. Okay. So when it is expired, it is weak. The lubrication that was put on is likely also not to be working. So then it means it is prone to breaking. So when you are getting a condom, the first thing you need to know is it expired or not? Okay. And also you need to check the package just to know imeraruka hiyo package yake. Because kama imeraruka, then it means its possibility could have been, the possibility that it's still effective in the prevention could have been tampered with. So if you've confirmed that it has not expired and the packaging is intact, then now you have to open it carefully. Okay, why carefully? Because some of these beautiful ladies wako na makucha mrefu sana. So hiyo makucha ensure kwamba isirarue. Okay, so just open the package gently. Then you have now to ensure, after you've opened it, ensure that it is facing the right way. For the female condom, it is inserted. It has a ring at the bottom. Okay, so it has to be inserted into the woman by the woman herself. And because it is inserted inside the woman, it has to be done in an clean environment so that usiguze uweke chini ndio it will bring you infections. Okay. For the male one, there's an aspect of rolling. So when you begin to roll it and you realize it is not rolling down easily, it means then you are putting it inside out. Okay, so it has to roll very easily. That will mean you are putting it in the correct orientation. If not, then you change. Then after you've rolled it down, there is always a tip at the head, kombele, the tip of the condom. There is some place which is reserved to now get hold of the semen, to collect the semen. So once you do that, of course, after an erection, then you have to ensure that the tip of that condom, you pinch ukombele so that hewa itoke. Okay. Remember, what you want is that the semen isitoke iende igiane, you expose the woman to your semen. So if you don't pinch to remove the air, then upon ejaculation, hiyo hewa itakuwa iko ndani ya condom, itasukuma the semen itoke. Okay, itasukuma. So once that is done, then you'll be ready for the action. There are some condoms which ulikuwa unavai umalize then upake lubrication, but sasa hii the lubricant imepakwa already, so you don't need to apply any other. You don't need to apply any other. Okay, so you've now put on the condom. Then you have to ensure that you keep it in place during the entire intercourse. During the entire intercourse, you have to keep the condom in place. Okay. So if you realize that it's slipping off, then you have to stop and use a new one. If it breaks, you have to replace it. Okay. You always have to ensure that it's just you're using one condom per act of intercourse, which means just per ejaculation. Okay, so it's one, utoe one, like that. So there are people who say kwamba ukipata sijui msichana ako namna gani vaa condom mbili, hiyo mbili it will slip. Okay, so do not use two condoms at once. Hatuvae moja ndani tena uvalishe ingine juu. You think you are now increasing the level of protection? No. It can either slip or it can either cause a lot of friction between them. Alafu zote ziraruke. So. Okay, so you've done your thing. Then now ejaculation has happened. You now need to withdraw from your partner. Okay, so you have to do it while the erection is still intact. That's the only time you can ensure that the condom will not be slipping off. Okay, so you have to remove as you hold it to ensure that it does not remain inside the woman. Then it is also a way to ensure that the semen cannot now spill to the woman. So once you've done that, then you find a way of wrapping it. Usishike juu na mkono, because remember, the vaginal fluid itakuwa iko juu ya condom. So wewe mwanaume ukishika tena hiyo juu, remember you are protecting yourself from her fluids. Okay, you are protecting yourself from her fluid. And during the intercourse with the condom on, your fluid as a man will be inside, but the fluid of the woman will be outside the condom. So ukishika hiyo condom, shika na tissue. You protect yourself from direct exposure to her fluid. Because if at all she is infected, then chances are very high that her fluid, her vaginal fluid, her vaginal secretion will be having the HIV infection. So usishike tu hiyo condom na mkono, hii mkono yako. Okay? Because you now end up exposing yourself again to her fluid. So get a tissue, ama atapata nylon, shika nayo. Inakusaidia kujitetea, expose yourself to the fluid. Then now, after you've done that, you have to dispose it properly. Usitupe kwa dirisha, yaanguke hapo nje, watoto waokote waanze kupuliza ndani. Okay? So wrap it, then dispose it in trash. Okay, dispose it in trash. Hapa msikue mnaweka mna flash, because inaenda ina block the plumbing. Ile siku unaona ati hii choo ime block, kumbe ni condoms zimejaa, zimeblock hiyo. Ukiflash maji iendange, kumbe ni condoms zimejaa. Okay, so you wrap it in a tissue, dispose it in a trash, then it will be disposed properly later. Most importantly, don't reuse condoms. Okay, don't reuse condoms. So just use one condom for one sexual act. Okay. So for all forms of sex, be it oral, be it anal, be it vaginal, use condoms. When you are putting on a condom, avoid sucking breasts. Avoid, some people want to go down there orally. Avoid it. Because then now, why are you putting on a condom? Yet you are subjecting your mouth to the same fluid that you didn't want your body to be exposed to. Okay. I will check. I'm sure there could be a few questions. I will check and answer before we look at now what happens if the test turns out positive. There's someone saying, sitasoma jina yako, anasema mimi siwezi vaa hizo vitu. Okay. So it's just like being told, ukitembea usiku ama ukilala, lala ndani ya net. Nobody will move around ensuring kwamba umelala ndani ya net. But mwenye atapata malaria ni nani? Si ni wewe tu. So it's the same thing with this. We will not be around to police you mukikutana na your girlfriend. Okay? But wewe, if you do what we tell you, you are likely not to expose yourself. But if you choose not to, then the repercussions zitakuwa ni zako. Someone is asking, again, I will not read your name. Do we have oral sex in Kenya, Doc? Maybe I need to ask, do we have oral sex in Kibabi? I think the answer is yes. Okay. Na nyinyi ndio mmekuja na hii maneno mengi. You've come up with so many things. Easy you want to do things your own way. Okay. So people do. Oral sex ndio nini? Is having sex in the oral cavity. Okay. You play sex in the oral cavity. Most of you call it blow. You call it blow what? Blow job or blow something. Okay. That's what you call it. Okay. As a girl, how can I know my safe days, doctor, please? Yes, siwezi funza sahi. You can come and see me. I will teach you that one. Okay. Because the safe days is about how many days the ova remains viable inside a woman and how many days the sperm can also remain viable inside a woman. I teach that in genetics. So this is not a genetics course, but ukikuja, I'm in ABC 310. ABC 310. When you come, I can talk to you as your big brother and I'll help you. Okay. Mwalimu wangu wa high school alisema hiyo fluid ya condom inaua uzazi. I think for you to say inaua uzazi, your high school teacher might have meant that the fluid inside the condom is a spermicide. So it's meant to kill sperms. There are some condoms that have the spermicide in, but there are others which don't. So the one that has a spermicide, after ejaculation, the sperms are killed because the spermicide kills the sperms. But now there are some condoms which are used to harvest sperm. So it means that condom cannot then have a spermicide. So not all condoms have the spermicide. So there are some zenye itaua, but there are others zenye haitaua. We've had cases of men, umelala kwa girlfriend yako, you used a condom, but then after you dispose it ukitoka, most of them now take the condom and they infuse themselves. Okay. So if it happens so immediately, chances are still high, because if the condom doesn't have the spermicide, then the sperms will not be dead in the condom. So there are some ladies, after the encounter, they now want to trap you. They will take the sperms and wajiweke. Okay. So with the such, chances are that some, if the condom didn't have a spermicide, then some of those sperms are still alive and they can potentially fertilize. Chances are minimal, but they can, and it has been recorded. We've had some pregnancies result from that. So hiyo fluid ya condom, sio yote inaua uzazi. Kuna yenye inaua na kuna ingine haiui. What if the condom is 10 kilometers away na nataka kukupea? Wewe ukienda kwa shamba, unafika kwa shamba ndio ukumbuke ningekuja na jembe, ama unaenda kwa shamba kama uko na jembe tayari? Okay. So it is you to know, then you have to be ready. It's you to know, then you have to be ready. Yes, someone is asking, please clarify on the point you said that one of the partners is positive while the other is negative, but they engage in copulation, there will be no infection. How is it possible? It is possible. If one person is positive and they enroll kwa kutumia ARVs, what the ARVs do, they will reduce, ukizitumia effectively and consistently, they reduce the amount of virus in your blood. We call it viral load. Okay? Because wanapima, waone hiyo virus iko kiasi gani ndani yako. So wakipima, itafika mahali waone kwamba imeenda juu ama imerudi chini. Ukitumia the ARVs consistently, the number of the virus within your blood system itapunguka until it will get to a point where there will be no virus in your blood. You are still HIV positive, but your blood doesn't have any virus. So there is no virus count. We say at that particular point, it is undetectable. So it is at that point now that if you engaged in unprotected coitus with your HIV negative, when you are HIV positive at that particular point, there will be no infection because there is no virus in the fluid. Okay? There is no virus in the fluid, but there is the virus in the body. lakini kwa fluid hakuna. Sawa sawa. So the trick, you use ARVs, ART, antiretroviral therapy consistently venye unatakikana. Okay. The only problem now ni maneno ya America venye wameanza kupunguza the funding. But ART ilikuwa imefanya mtu hata ukuwe na HIV could still live a healthy life, na hata hakuna mtu mwenye atajua kwamba hata uko na hiyo ugonjwa. Okay. So it is possible. I will look at the last thing, then we continue. Someone is saying, is it 100% guaranteed that ukifanya sex na a HIV positive person utapata infection, ama it will depend on certain factors? It will depend on certain factors. One, are you using a condom correctly? Then two, is the HIV positive person on antiretroviral therapy? Then the third thing, punguza madoido, sucking, sijui kulamba wapi, wachana na hiyo. Okay? Because it just reduces. The more ile madoido mnaongezanga mingi, ndio inaku expose sasa. Okay? So for someone who is HIV positive, reduce the rate at which you can be exposed. Okay? So avoid the suckings, avoid the touchings of whichever place that you like to touch. Okay, so one, if the person is HIV positive, protection. Then two, the HIV negative person should take PrEP, pre-exposure prophylaxis. So take PrEP, use a condom, then ensure that the HIV positive person has been on ART, because the ART will lead to a reduction in the viral count. Okay. Somebody saying, doctor, please, to pay a physical class hata moja. I have lots of questions na nataka ujibu nikikuona class. Now, my dear, you are 3,000 students. Tutakaa hall gani kweli kwa hiyo physical class? Okay. It's impossible. Okay, it's impossible. But on the notes, you have my email, isn't it? You have my email. And again, most importantly, ninapatikana ABC 310. ABC 310. Unaweza nipata Monday, unaweza nipata Wednesday, unaweza nipata Thursday. Sawa sawa. You find me in ABC 310, Monday, Wednesday, Thursday. You can write me an email. Your class reps, most of them have my phone number. I'm sure they can give you my phone number. Then you ask me what you want. If you want to ask me ni kujibu ukiniona, then come to ABC 310 today. I'm in the whole day. Kuja Wednesday nitakuwa, kuja Thursday nitakuwa. But a physical class is difficult because hakuna hall yenye itashika nyinyi wote unless we do it in the field. Okay, na hiyo itakuwa ngumu kidogo. Okay, so okay, very good question. Between male and female, who has high chances of obtaining HIV? Well, I will come to that, but the bottom line is female. The bottom line is female. Okay? The bottom line is females will have a higher chance. Why? Because from a biological perspective, we say sex happens inside a woman. Okay, sex happens inside a woman. So it means the woman has a higher exposure to the possible viral source compared to the man. Then also, it is the woman now who will receive all the fluid from the man. Is the woman who will receive the fluid from the man. Then when we'll see some of the factors that make women kukua more vulnerable, more exposed. Even in most of your relationships, it is the man ndiye anajua akikuja hivi tutalala na yeye. Msichana atafikiria tu nimeenda sijui kufanya nini. So most of the relationships that we have, they portray women to be the lesser partner. So if a woman will be so firm kwamba we don't have sex, then the man will say, hata basi wacha tuachane. So it presents a woman or a lady in a way that for her to maintain the relationship, then she has to give in to the sexual demands. Okay. So there are many other reasons, but one is culture. Then two is biology. So in any sexual encounter, the woman is more exposed. It has a higher surface of her body exposed to the potential source of the virus. Then two, sex is happening inside her. So if there is any person who receives, because it is the semen, the semen that will have a very high rate of viruses, if at all the man is HIV positive. And yet this semen will be deposited inside the woman. Okay, so such factors make the woman to be more predisposed than the man would be. I will now come back to the notes and continue now looking at if you've undergone a HIV test and the test has turned out positive, what will you do? Okay, so if the test turns out positive, it most likely means that you might be infected. And now what you need to do is you have to live positively with your current health status. Okay, so living positively then means you lead a healthy life so that you can manage your virus effectively. How do you manage it effectively? Through consistent treatment, the ART. Then you adopt a healthy lifestyle. Mambo ya kusema sasa nimepata ukimwi, sijali, wacha tuti, mwenye na ako mbele nafagia. You have to stop because we call them ecotypes. Labda umepata this particular strain, ukiendelea utapata strain ingine. No. So you have to lead a healthy life. Embrace treatment consistently, adopt a healthy lifestyle. Kula vizuri, punguza risky sexual behavior, then emotionally and mentally, upate proper support. So the best way for the support, you join groups because there are other people who are also living with the virus. So you have to join those groups, then you begin to support each other. You share experiences. Okay, kwamba mimi venye nilipitia hii changamoto hivi ndio nilifanya. Okay, so some of the ways, one, adhere to the antiretroviral therapy. So the cornerstone of HIV treatment is ART, the antiretroviral therapy. Antiretroviral therapy is a combination of HIV medications, which will prevent the virus from replicating inside your body. So when you are adhering to the ART therapy, it will help to ensure that the viral load is undetectable. Once the viral load is undetectable, then you can now not infect other people. Then two, when you use ARTs effectively and consistently, remember, we talked of getting the virus and developing AIDS. So AIDS is when the immune system has been destroyed. So when you are using ARVs, you are on ART. The ARTs will not allow you to develop full-blown AIDS. Full-blown AIDS is at the point where your immune system has been destroyed completely. So when you are enrolling on ART, they will help to preserve your immune system so that it can function normally. Okay, so those two will now lead to a reduction in the risk for you to transmit HIV to others. Then, when you've turned out to be HIV positive, you now need to go for regular health checkup so that they can monitor your overall health status. They need to determine the viral load, that's the number of viruses, particles that you have. They need to determine the CD4 count because their CD4 count will be reducing. But when you are using the ART, the CD4 count itabaki tu mzuri, the viral load itapunguka. So you need to go for the regular health checkups so that they can monitor your health, your overall health status. Because we have various ARVs, possibly yenye umepatiwa could not be working. So when you undergo regular tests, they can know if the ARV the combination you are using is working or not. If it is working, you continue. If it is not working, they change, wakupatie ingine. Okay. The other thing is now you need to adopt a healthy diet. Because once you have the virus inside your body, then your immune system is under attack. So you need a balanced, healthy diet that will support your immune system. Okay, so you need to have fruits, you need to have vegetables, you need to have whole grains. Okay, so you need to have very healthy foods. Drink plenty of water so that you stay hydrated. Okay. It's not about an expensive meal. It's just a healthy diet. You can still do a very healthy diet with a very modest budget. So when you are thinking of getting a healthy diet, don't think it's a preserve of the rich. Even just in the village, there are ways in which you can assemble a healthy diet. Then I'll get into regular exercise. Exercise regularly so that your body is kept strong and you reduce these lifestyle diseases, which we will see at the end of it. So you want to reduce the risk of these other common health problems, the cardiovascular diseases, diabetes, obesity. Okay. When you exercise regularly, when you walk, when you run, you exercise, you go to the field and do a bit of exercise, even just take 30 minutes per day exercising. It helps to reduce some of these lifestyle diseases, diabetes, obesity. You know, they are kept at bay. Then manage stress, manage your stress. Because when your mental health is right, then overall your well-being can be rated to be very high. But when you are consistently stressed, you are likely to undergo depression, and that will have a very negative impact on your immune system. So how do you manage stress? Join a support group. Because truth be said, if you turned positive today, many people will undergo stress. They will be in some state of denial. Okay. But if you have a group of people who will tell you, no, we've been there, but here we are. Okay, this is how I've been living. So live your life this way. I've lived with this virus maybe for 10 years, 20 years. So you will begin to see that actually just by turning a positive test is not a death sentence in itself. So don't allow to be stressed. It's true that being told you are positive will shock you. You'll be in a state of denial. But find refuge in people who've walked that road before. Join a support system. We have got so many currently available in the country. Okay. Then avoid drugs, avoid excess alcohol. Okay. avoid them, because what they do is that they will just weaken the immune system. Then once the immune system is weakened, the risk of other infections will just increase. And once the infections increase, the ability of the ART to work effectively will be diminished. Okay. So avoid smoking, avoid excess alcohol, avoid use of drugs, because then that will just make it difficult for you. Just a minute. Okay, so you avoid excess alcohol, you avoid smoking, you avoid drugs, then you reduce chances that the immune system will be weakened. Once the immune system is weakened further, then now the opportunistic infections will come in. Then the ARTs might not work as effectively as they could. Okay. So with alcohol, you don't, if you are a social drinker, the better. So you just limit the amount. Okay, you limit the amount. Importantly, then you have to now get vaccinated. Okay, you have to get vaccinated against flu, against pneumonia, against hepatitis, and other diseases. Because what you are trying to do, you now want to ensure that your body cannot just become a playground for other diseases, because already your immune system is under attack by the HIV virus. So what you need to do, you have to prevent other infections from getting into your body, because you don't want to burden your already immune system that is under attack from HIV with other infections. So you look for the vaccinations out there to help you stop the infection, possible infection from other diseases or disease-causing microorganisms in the environment. Okay, so all you are trying to do with the vaccinations is just to reduce the amount of work that your immune system will be subjected to. Sababu, it is already dealing with the HIV virus. Okay. So, most importantly, practice safe sex, because you are positive. You are positive. So if you don't practice safe sex, then you will transmit. Okay. If you don't practice safe sex, you will transmit the virus. You will transmit the virus. Then stay informed and educate yourself. So read about HIV, read about how you can protect, how you can, So you have to stay updated on the issues on how you can manage your condition effectively, because you are the first person. Before you even go to your healthcare provider, you are the first person mwenye inatakana ujisaidie kwanza, ndio usaidiwe na watu wengine. Have a support system. So if you are in a relationship and it turns out that, or assume as you came in as first years, you didn't choose your roommate, maybe wewe ulienda tu kwa room, umepatiwa roommate, then along the way you realize there are some drugs anameza kila wakati. With Google unaangalia unaona ni ARV. Okay, don't go around discussing that person. Okay, anza kuacha kuambiana huko nje kwamba bwana huyu jamaa kumbe naona anameza hii dawa, kumbe huyu jamaa kumbe iko namna hii. Hapana. Okay, the best you can be, if you don't want to help that person, just keep quiet. Okay? Because you need now friends. Such a person needs friends who will support, who will offer the social support. So you need to have a support system, a network of friends, a network of family members, a network of healthcare providers, a network of peer groups that provide you with the emotional support. Okay, will offer you with the practical assistance in managing HIV. If you had a girlfriend mwenye anatembea akikutangaza anasema huyu jamaa kidogo tu angeniambukiza, you can actually take legal action. You can sue someone mwenye anatembea akitangaza your status. Okay, so it is your decision kuachana na mtu on the basis of their HIV status, but you don't need to move around announcing the status of that person, because huyo mtu akipata evidence kwamba unamtangaza anaweza kukushtaki. So because such a person needs a very strong support network. You can just tell that person, I'm not comfortable that we continue with this relationship, but let's just be friends. Okay, so ukipata fruit kwa barabara mnunulie, mpatie kule, but now avoid being in a place yenye ni wewe na yeye tu, because you might end up, the feelings might come, then you realize you've ended up exposing yourself again without maybe proper protection. So such a person needs a support system, but not hiyo ya moshene akiingia kwa lecture room mnamwangalia nyinyi wote, mnapinduka tu akiingia hivi kwa mlango mnamwangalia hivi nyinyi wote, you end up now stressing that person even more. Okay, so when you end up finding yourself to be infected, you have now to try and surround yourself with the people who understand your condition, people who are supportive. Okay. So in such a case, don't lock yourself up in your room na uanze kujihurumia. Hapana, reach out. Go to the dean of students, talk to them. Go to the clinic hapo, talk to them, tell them, yeah, we underwent a test and these are the results. So I'm here to request for your help, because at the end of the day, it is your life. It is your life first. The clinic or the dean of students has thousands of other students that they are dealing with, but it is your individual responsibility kushughulikia maisha yako kwanza. Okay, so ensure that you are reaching out, ensure that you have friends who will help you, okay, who will support you when you need their support. So in summary, living a healthy life is achievable even for people living with HIV. So when you can do that, you can live a healthy life by using the right combination of medical treatment. We call that ART. You also have to choose very healthy lifestyles. Okay, take care of your mental health and ensure that you have social support. Then the ART utapatiwa. So it is upon you to ensure that you have consistent adherence. Kama ni kumeza asubuhi na jioni, meza. There will be no one there to tell you. It's upon you as a person. Then you have to undergo regular checkups so that you know the state of your health, you know the CD4 count, you know the viral load. Ensure that you have balanced nutrition so that you can help boost your immune system. Engage in physical activity so that you don't have obesity, you don't have these cardiovascular diseases, you don't have all the other lifestyle infections, and manage your stress. If you do that, then you will have an improved quality of life and you are likely to live long, healthy life just like any other person. The good thing is the current healthcare system in Kenya offers all these services. So it is just you to present yourself to a health care provision, then they'll work with you. Okay, they will work with you. So we'll quickly look at now the ARVs, the antiretrovirals. Okay, so the ARV drugs, antiretroviral drugs. So the antiretroviral drugs are medications that are used to treat infections that are caused by the human immunodeficiency virus. So these drugs, these medications, they work by inhibiting the replication of the virus. So they prevent this virus from multiplying and weakening the immune system. Okay. Then after the ARVs, there is now the ART. So ARVs, the antiretroviral drugs, are medications. But the ART is now a combination of ARVs. So you have many ARVs that are put together, then they become an ART, an antiretroviral therapy. And the main aim of ART is to manage the HIV infection. How do they manage it? They help to suppress the viral load. They reduce the amount of virus that will be present in your body. Once the amount of virus has been suppressed, then you are likely to maintain a healthy immune system. And if your immune system is healthy, has not been destroyed because the HIV virus numbers in your bodies have been suppressed, then your progression to AIDS will be prevented. Okay, your progression to AIDS will be prevented. So ART is a combination of ARVs, which are used to manage HIV infection. ART does manage HIV infection by reducing or suppressing the viral load. Once the viral load is suppressed or is reduced or is low, it means you have very few viruses inside you. Then the few viruses will not destroy your immune system. So your immune system will remain healthy. Once your immune system is healthy, then you don't progress to AIDS. So hautapata AIDS, but you'll still be HIV positive. So the ARVs, they have classes. They come with different groups. Okay, so the ARVs are grouped into classes based on how they work to inhibit the HIV viruses. So you remember when we were talking about the life cycle of the virus, ARVs target that life cycle. Okay, so there are some which will target the reverse transcriptase. HIV needs the reverse transcriptase to change RNA to DNA. So if there is a class, if there are drugs that will go and block that enzyme, then there will be no DNA formed. Okay, so the RNA will be there, but then the DNA will not form. Okay, so that's the group that targets blocking the reverse transcriptase. The RNA needs to change to DNA before it can integrate into the host genome. So if it does not change from RNA to DNA, it will not integrate into the host genome. So that's the first class. They are those that target to block the reverse transcriptase. Then we have those ones that will target to block the protease enzyme. The protease enzyme ndio itasaidia kucombine the various proteins so that a HIV virus that is mature can be formed. Okay, remember there will be an envelope somewhere. There will be all manner of proteins that are now being created. So the protease enzyme ndio ina combine hizo zote so that you have now a mature HIV virus. It is now that mature HIV virus that will be infectious to go and infect new cells. So when you are blocking the protease, then you are blocking the formation of a mature HIV virus. Okay. Then there are those that will target stopping the integration of the HIV into the host genome. So the integrase inhibitor. If the HIV DNA does not integrate in the host genome, then there will be no formation of the HIV proteins. Okay, so once that integration has been stopped, then hakutakuwa na kutengenezwa kwa the proteins of the HIV, which now the protease enzyme will begin to assemble. Okay, so there are ARVs that will target blocking the reverse transcriptase, the enzyme that HIV needs to change RNA to DNA. There are several classes that will target the protease enzyme, inhibit it. They block that protease enzyme. The protease enzyme is the one that HIV needs to assemble mature viral particles. So kama mature viral particles cannot be assembled, then they cannot live to go and infect new cells. Okay. There are then sets of ARVs that will target the integrase, the enzyme that the HIV needs to integrate, to join the host genome, the host DNA. If you stop that enzyme, then the HIV will not find itself part of the host DNA. If it's not part of the host DNA, then no viral proteins will be formed. Okay. Then there are those that will be preventing entry. Okay. So there are some ARVs that will block HIV from entering the human cell. Okay. So it's like you have a door yenye umefunga kwamba wezi hawawezi wakaingia kwa nyumba yako. So the entry inhibitors, they would stop the HIV virus from entering the CD4 cells. So I will share these notes, then you will see where there is a diagram showing where each of those classes of viruses inapatikana. Okay. The classes of ARVs in a diagram itaonyesha where they are found. So the entry inhibitors, they are trying to stop the virus from entering, from attaching. Okay. Then the reverse transcriptase inhibitors, they are stopping the viral RNA from changing to the viral DNA. So itabaki tu as a viral RNA. The integrase inhibitor is stopping, in the event that the viral DNA was formed, the integrase inhibitor will stop the viral DNA from joining the host DNA. Then the protease inhibitor, if it happened that the integration had already happened, then after the proteins have been formed, the protease inhibitor will stop the formation of a mature virus particle. Because once the virus particle is formed, then it is infectious. Itatoka sasa iende ku infect somewhere else. So when you look at these classes of ARVs, then it shows you why you, even the PEP, okay, the post-exposure, why you need to take it as early as possible. Because if you are dealing with a PEP, which will help you to prevent entry, for example, it has to be dealt with immediately. You will be asked, ukienda kutafuta the PEP, if you are seeking it from not just a chemist, but if you are going to a hospital, they will ask you when the possible exposure happened. That will give them an idea to know which type of PEP to give you. Because if you say you've had the exposure in the last maybe 10 minutes, they will know possibly they can give you one that deals with prohibiting entry. But if you had the exposure maybe 2 hours ago, 3 hours ago, or even yesterday, then they will know they can now possibly just give you what will stop the assembly of the viral particles. So they can give you the protease inhibitor. So that's why it's important, after a possible exposure, go for PEP, go for prophylaxis. Because the earlier you arrest it, the better. The earlier you arrest it, the better. Okay. We've talked about viral load. So viral load is just the amount of HIV that will be present in your blood. Okay. And it is measured as the number of virus particles per milliliter of blood. So they will take your blood and maybe say it's 1 milliliter, then determine how many viruses are present in that milliliter of blood. Okay. So if you have a high viral load, it just indicates that HIV is actively replicating. But if you have a very low viral load, then it indicates the alternative. Kwamba, your virus is not replicating very actively, which could mean the ART is actually working. So regular viral load testing is part of ART monitoring in Kenya. So these are part of the checkups that you need to go if at all you've returned a positive HIV test. Another thing is the CD4 count. So CD4 are cells that deal with fighting infection. So when you are on ART, the expectation is your CD4s, if the virus is not replicating so fast actively, then your CD4 count should be high. Okay. So the CD4 count is just the number of the CD4 cells in a cubic millimeter of blood. So a higher count indicates a stronger immune system. If you have many CD4s, it means you have a stronger immune system, a stronger protection against infection in your body. So HIV will lower the CD4 count because we said it attacks the CD4. Then we have a group that we call CD8, ndio itakuja itoe cells which have foreign particles. So HIV is foreign. So if a HIV targets CD4, then CD4 zenye ziko na HIV zitakuja kutolewa. So which means when you have a high HIV load in your body, then you are likely to have a low CD4. Okay. So HIV will lower the CD4 count. And in essence, that will now lead to a reduction in your ability to defend infection in your body. So when you have a low CD4 count, then there will be an increase in the opportunistic infections. We talk of resistance when the virus has become less responsive to the effects of some of those ARVs, the drugs that you are using. The virus can become less responsive. It will not be responding to them. Then you say that virus has now become resistant. The aspect of resistance comes up because of mutations, okay? Because of mutations, okay? So when we were talking of ARV, ART, there was a concept of adherence. Adherence just refers to the extent to which a patient follows the prescribed ARV regimen. Ukiambiwa una meza 2 asubuhi, meza. Moja saa 7, meza. It's not about how you feel that morning, but it's about what you are told to do. Okay, it's about what you are told to do. So adherence is how you follow the instructions. And the best way to deal with HIV infection is having a very high adherence, because that is very crucial if you want to effectively suppress the virus. Okay. So the higher level of adherence just means you are likely to be successful in dealing with HIV infection. Non-adherence can be due to stigma, where people are talking ill about you just because you are HIV positive. We are human beings, so you tend to have low morale, na hiyo inapunguza kutaka kufuatilia kupata hiyo dawa ama nini. At times there are people who have side effects, okay, and even at times there are logistical barriers, because hizo ARVs hazipatikani tu at times in the next available maybe dispensary, so you have to travel uende uipate. So if it happens that you don't have the logistics in place to enable you, for example, move from where you are to where you can access the ARVs, then that can lead to non-adherence. But the ideal thing is that we should have a very high level of adherence. Okay. We talked about PrEP, we've talked about PEP, so that is not new to us. Some ARVs come with side effects. These are just unwanted physical or mental effects that are caused by ARVs. There are some people who will suffer from nausea. Wengine watakuwa na fatigue. Others will have skin rashes. Wengine wataumwa na kichwa. Okay. But in the long term, the expectation is you will have a problem with your liver. Okay, because liver is what deals with the detoxification. So because you are on a long-term use of ARVs, which are drugs, they are chemicals, then you tend to overwork your liver. Okay, you tend to overwork your liver. But there will be side effects. They differ from one person to another. But when you encounter these side effects, the best thing you need to do is share with your healthcare provider, because then they will help by giving you alternative drugs. So when you have a side effect, don't stop. Useme nawacha hii dawa, hapana. Go to hospital where you got the ARVs, discuss with your doctor or whoever it is that is providing that health support. They will find a way, okay, of helping you to change and get proper. Someone at some point asked me about undetectable and transmittable, okay, that the U is equals to U, that concept. So this is when you talk of a level that is undetectable, a level that is untransmittable. Okay. It is based on research which showed that there are people, even if they have HIV with consistent use of ART, their viral loads become undetectable. So the first thing is there is a HIV infection. Someone is HIV positive. But what they did they not only went for ART, but there was consistent use. There was a very high adherence. The result of that is the amount of virus in their blood will become undetectable. Once the amount of blood, the virus in the blood is undetectable, at that particular point, that virus is untransmittable. So the virus cannot be transmitted to their partners. And it is now at that point that people who are discordant couples, one who is positive, the other one who is negative, will be encouraged, if they want to have children, to attempt now having unprotected coitus. So undetectable and transmittable is a concept based on people who are HIV positive consistently observing adherence to ART, to the point that the viral load within them is undetectable. Once the viral load is undetectable, then the virus becomes untransmittable to their partners. So at that point, you can now engage even in sexual intercourse that is not protected. And your virus, your partner has a very low risk of being infected. Of course, your partner will have to take PrEP, the pre-exposure prophylaxis, before engaging. Okay. So we've seen the concept of ARVs, but now the question is, when should people with HIV start using antiretroviral therapy? When should they be enrolled? So it should be immediately upon diagnosis, what we call the universal treatment for all. Okay. So once someone is diagnosed to be HIV positive, that is the right time that they should be enrolled. So it should be as soon as possible. So even if your CD4 count is still high, you need to be enrolled. So you think of HIV like to be sort of a thief. We always lock our houses, even at night when we are sleeping, not because there is a thief, but you don't want a thief to do it, to come in. That's why we lock our houses. We want to prevent. So you don't wait for your CD4 count to be so low before you enroll, but you enroll as soon as possible so that you can prevent the HIV virus from raiding the CD4s to reduce their count. Okay. So it is should be as immediate as possible. Okay. So when now for pregnant women, they have to be enrolled to prevent the vertical transmission. Okay. We know HIV being an STD, we say it undergoes horizontal transmission, meaning from one person to another. But vertical means from parent to child. Okay. So when you are enrolling a pregnant woman, you are preventing mother to child transmission. That is called vertical transmission. Then people who are at risk of HIV transmission, depending on what you do. For example, people who indulge in same-sex relationships, the sex workers, people who inject drugs, those who have HIV positive partners, okay, are advised to start ARVs as soon as they test positive. Because by virtue of your risk of exposure, you tend to protect your health more when you begin using the ARVs as early as possible. Okay. Then in the case that your HIV has become resistant to the ARV you are using. Okay. So it means the virus is no longer responding to the treatment that you are using. Then you have to switch to an alternative ARV. So for you to know that, it means upon returning a HIV positive test, you must continuously be subjected to more diagnostic tests to know, for example, how is your viral load? How is the CD4? If you are using ARVs, but still your viral load is high, it will just mean that the HIV virus in your body is not responding to the ARV, the ART that you are using. So that will mean they now need to switch for you to change and begin using a more effective one that can lead to viral suppression. Okay. So in the initiation of ARV, at least in Kenya, there is the universal treatment. So once you are diagnosed with HIV, you should begin the ARVs, regardless of your CD4 count, regardless of the symptoms. Then pregnant women with HIV should start ARVs immediately so that they can reduce mother-to-child transmission. Okay. People who have HIV-related infections should be enrolled of ARVs as soon as possible. Individuals that have a high viral load, they should start treatment so that they can reduce the possibility of transmission. Then the high-risk populations, the sex workers, male to male, people with HIV-positive partners, they need to start ARVs as soon as possible. Okay. Then treatment for prevention. People in serodiscordant couples. So you have a HIV-positive partner. You should start ARVs to reduce the risk of transmission. So for treatment for prevention, you are given the ARV, not that you have HIV, but you are given the ARV so that you can be prevented. So that is a treatment you are being given for the sake of preventing the acquisition of the virus. So that is the treatment for prevention. Okay. I see there are people who have carried up their hands. I will ask the other guys if they can unmute those ones who've carried up their hands. I'm told there are 2. So that in the last 10 minutes, we can have some questions. Then we'll end the class at 10.
Okay, Dr. Let's see, we have Oeta. Oeta, unmute yourself. Oeta and Vincent, whoever, unmute yourself. Justus. Oeta is unmuted. Ask your question.
Thank you, sir, for giving me this opportunity. I would like to ask you to briefly explain the difference between pre-exposure prophylaxis and post-exposure prophylaxis.
Okay, so the PrEP and the PEP. So pre-exposure means, okay, prophylaxis is comes from the word prophylactic, which means preventing. Okay. So pre-exposure prophylaxis means you are preventing before the exposure. So you take some medicine, some pill, kuna dawa unameza kabla hujakuwa exposed to the virus. That is the pre. You are doing it before the exposure. So that is PrEP. But PEP is post post-exposure, meaning you are trying to prevent after you've been exposed. So you've had a sexual encounter, but now you want to use a medication to possibly try and ensure that the virus does not get into your system. So pre-exposure prophylaxis, PrEP, is using a medication before as an exposure. But PEP is post-exposure, using medication after a possible exposure. Sawa.
Yes.
Okay.
Let's check another one. Who is this? Justus, unmute yourself.
Hello, sir.
Yes.
Yes.
My question is, why do some people say that once you have been infected by HIV and AIDS, then you have a minimum or less than 20 years limit of living? And then another question is, now that the vaccines can control how your body can fight the diseases, does it mean that once you have been vaccinated against all these chronic diseases and some of the more commonly diseases, is your body capable of fighting the diseases? Or does the HIV virus affect the vaccines that are being immunized in our bodies?
Okay, so the vaccination helps to ensure that there is no other infection coming into your body. Because with the HIV, already your immune system is under attack from the virus. So if you have already an immune system which is dealing with the virus, HIV, which is targeting the CD4 cells, it means any other infection can now come in, what we call opportunistic infections. So what you want to do at that particular point, unataka kuhakikisha kwamba your immune system ing'ang'ane tu na HIV, lakini isikuwe na any other distraction. So ndio unakuwa vaccinated against these other infections. But the HIV virus does not interfere with the vaccines in your body. Okay, because the vaccines are not targeting the virus. The vaccines are targeting other pathogens that will come and also put more load to your immune system, which is already under attack from the HIV virus. The first question you had said that people will tell you have 20 years. That was before the HIV virus was properly understood. That's when people could not live long. But now with the ARVs, with the ART, people are living normal lives. Watu wanaoa na watu wanazaa. Okay, so the only thing is, once you test positive, you now need to enroll for ART and you have a very high adherence, so that utumie hizo ARTs venye umeambiwa na venye unatakikana, and you go for continuous checkup so that they monitor your viral load and they monitor the CD4. If you enroll to an ART program, you live a normal life. There is a lady who, I think she's lived almost for 30 years now with the virus, na amezaa watoto watatu who are all negative. Okay, so it's possible. It's no longer a death sentence. It's just a challenge that you confront positively na unaishi tu vizuri. Kitu ya kwanza unakubali. You seek support, you live positively, then you enroll for the ART. Okay, yes, the last question.
Doc, I have some questions here.
Yes.
Yeah, someone has asked, Can pubic hair aid in minimizing HIV transmission?
No, it can't. So sio kwamba ukinyoa huwezi pata ama you know, it's actually when pubic hair when anything is moist, you increase chances that there will be more life at that particular point, and that's the whole thing na mambo ya kusema circumcision with HIV transmission. Okay, so for you not just to reduce HIV, ensure that you are clean. So it's nothing to say kwamba if you have it or if you don't have it, but when you have a lot of moisture anywhere, you'll have a lot of biological activity. Then there will be so much life at that particular moist place. Viruses included, bacteria included. That's why usipooga, you begin now to have scabies, you begin to have, because there is a lot of cover on your skin where now other living organisms begin to live there. So usiponyoa pia, na sio tu kwa kichwa, usiponyoa even in those other places, you are likely to attract so many other things that will cause you more problems. Remember, if there is maybe a bacteria that will cause a cut in your pubic area, so you are scratching because hukuwa umeoga, hukuwa umefanya nini, that cut ndio ita increase uwezekano wa now a fluid coming in. Okay, so cleanliness will ensure that you avoid scratching, you avoid cuts. It is through those cuts that the secretions from the other partner will now get access into your body. Okay, so let's be clean, and I mean clean everywhere. Okay.
Another question, Doc. Sir, what if you are allergic to ARVs? What do you do as Teresa?
Yes, there is we talked of the side effects. So we said you have to undergo continuous tests. When they realize the side effects you are having, they will change mpaka upate the correct ARV yenye hautakuwa na side effect. Okay, so you might be allergic to one, but you will not be allergic to all.
Another one, what happens when you take ARVs and you are negative?
When you are negative, then it means that's what we are calling now treatment for prevention. Okay, so ideally, even the PrEPs and the PEPs, they're just ARVs. Okay, so maybe you are HIV negative, but you have a partner who is HIV positive. So you need to take an ARV, you need to take a drug to ensure that the infection in that person does not get into you. Okay, so it will just help you to prevent. That is if you are engaging with a HIV positive person. But don't just take ARVs when you are not engaging with any sexual relationship with someone who is positive, or then that is wasteful.
Is it true that someone with blood group O positive cannot get HIV?
No, it's not true. Blood groups have nothing to do with the viral infection. Okay, so you will get irrespective of which blood group you have. Okay, the only thing is there are people who are discordant, and there are some mutations that when you have, you don't get the virus. Okay, so I will just type one mutation in the chat. I'll type one mutation in the chat. I will direct it to everyone. So there is a mutation, the CCR5. Then in genetics, we call it Delta 32. Okay. So there is that mutation I've sent you, CCR5 Delta 32. If you have that mutation, and if you are homozygous, all of you did biology, I guess. So if you have a double copy of that mutation, you don't get HIV at all. But when you are heterozygous for it, then you get HIV, but its transition to AIDS inakuwa very slow. Okay, yeah. So if you are homozygous, you don't get it. If you are heterozygous, you get HIV, yes, but the transmission to AIDS inakuwa very slow. Why was it possible to cure corona than HIV virus? Mutation. The HIV virus mutates so fast. Okay, so that's the problem. Mutation. Bonnie, we are 10. Yes.
Yeah, kuna mtu hapa anauliza P2 ni nini and what is its role?
P2 sasa hiyo wameenda you want to prevent pregnancy. That's why you use P2, the postino 2. Okay. So P2 inamezwa to stop a pregnancy, most likely after the sexual encounter. How P2 works, one, it can, you of course, ladies, when you wameitumia, they will tell you, you have to use the P2 within a particular time. So while at times there are 2 or 3 types of the mechanisms of how the P2 works. One, inaenda ijaribu kupata the ova before the sperm gets to the ova. It makes the ova to be impermeable, so the sperm does not enter. Okay. The second category, there are those that will go and now try to make the uterus receive the zygote in case there has been already fertilization. So it means you have to take the P2 yenye ina target to make the ova to be impermeable. It has to be taken before fertilization. But the P2 that targets to make the uterus not to receive implantation, for implantation not to happen, that P2 has to be taken before implantation happens. Okay, so they are, ladies they know the timing. So ukichelewa, hata ukipewa P2 lori mzima umeze, utakuwa hakuna kitu unafanya. Because if you are targeting to stop fertilization, yet fertilization has happened already, and there is nothing you are doing. If the P2 you are using has to target stopping implantation, once implantation happens, then hata ukimeza, wakifungua tap ya P2 imwagike tu kwa mdomo, there is nothing that will be happening. So P2 is about timing. But again, they are hormones. So sio ikuliwe kama njugu. It has to be used as a preventive mechanism ya ajali. So when you've been raped, for example, sio ile mnaenda kwa boyfriend, we mwenyewe unajua tu niko naenda huko, na kesho asubuhi unaamka kutafuta P2. Unalala huko a whole week, na kila asubuhi unamezanga P2. You distort the hormonal balance in your body. Okay, and at some point, if you prolong the use of P2, then you are likely to change the hormonal balance. Then sasa tunaanza kuwa na difficulties at some point when now you want to be pregnant, for example. Okay. So P2 inatumika tu as an emergency. Sio njugu ya breakfast. Kila asubuhi kwenda kwa chemist kutafuta P2. Hapana. There are condoms. Okay? There are condoms. Use condoms. Okay? Or abstain. Lala tu, panguza tu ye kwa mgongo mpaka asubuhi, mwambie wacha tungojee sweetheart. When the days are safe, we will engage. Okay? Yes.
Peter Tiang says, can ARVs help those thin negative ladies to increase their body size?
At thin negative.
The case of one daktari.
Unajua sasa wanasema beauty lies in the eyes of the beholder. Some people will like them thin, others like them. Maybe the opposite of thin is thick. Okay. So HIV, among the effects of ARVs kwa wale watu wanapenda kupimia wasichana macho ama kupima partner na macho, ati kama angekuwa na ukimwi angekuwa amekonda. Most people upon enrolling to ARVs, one of the side effects, wengi, si wote, but wengi wananona. Okay, wengi wananona. So that has been misconstrued, kumaanisha kwamba ukitumia ARVs unanona. Na hiyo ndio uliona at some point, I think it was in Nairobi Kibera, walianza kulisha kuku zenye wanauza town hizi, wanazipea ARVs so that zinone haraka, zikuwe kubwa, so they can go and sell them, unaona, to gain weight. So it's true that among the side effects of ARVs is weight gain, but it is not for everybody. Wewe ukitaka msichana wako anone, lisha yeye mzuri, ama wacha kumstress, tena atanona tu. Lakini kuna wengine wenye kulingana na ile familia ametoka, hata ukimpeleka aishi tu kwa hoteli, kwa jikoni ya hoteli, bro hawezi naona, sababu is genetic. Okay, so choose the variety, have your choice based on your interest. Ukitaka mnono, there should be more than enough supply. Ukitaka wafupi, wakonde, there should be enough supply. We are 10 minutes past 10. People are still raising their hands. Bonnie, I think we might need to end. Wengine tafadhali, you can just write me emails, I will answer, or you can come to ABC 310 today, on Wednesday, or on Thursday. You will find me and I will answer questions. Sawa. I had not shared these notes, but I'll be sharing after the class. Sawa. And I think we can end there, unless if there is a very burning question.
Kiforo, you are unmuted and your hand is raised.
My question is, which criteria are used by the medics to ensure that they're giving you the right class in ARVs?
So the criteria one, anytime you go to hospital, wanakuulizanga unatoka wapi. Okay, so it's a way to try and understand sort of which population do you come from. So there is some baseline which is used when I go, if you come from this particular population, this particular ARV will work better, this particular class. So once they do that, because they could have known, for example, that this particular class works best in Western, this one works best in Eastern, this one works best in, you realize most of the regions in Kenya we are grouped on the basis of our genetics, that's our history. But once you are now brought into that group, that class of ARVs, there is the continuous monitoring. So if you are admitted to a particular class, na wanaona kwamba wakipima your CD4, wakifanya the viral load hazipunguki, viral load bado iko high, CD4 bado iko very low, then they now have to change. Okay, so the initial admission is based on regions. Okay, so the distribution is largely on the basis of how the drugs perform on the people in these different regions. You are admitted on that, then upon monitoring, they will change on the basis of the results they are getting. So the viral load, the amount of viral particles in your blood, and the CD4 count, how many CD4s, are the CD4s increasing, and is the number of viruses reducing? If that is not happening, then they change. Then also the side effects. If a particular ARV is causing you so much side effects, then they have to change and give you a different class. Okay, not unless. Doctor,
I think we might answer the rest maybe next time.
Yeah, there's just one. Someone is saying, you said that we should not publicize those people with HIV. What about those who want to deliberately transmit the virus to innocent people? Infecting someone deliberately is criminal. Okay. If, for example, you got intimate with someone without protection, na wewe ulipimwa ukajua kwamba uko na ugonjwa, that person can sue you. Okay, that person can sue you. So if you move around and sleep with people, then if it is eventually realized that you are doing it well aware of your HIV status, then you can be sued. Unaweza ukashtakiwa. So we don't publicize the HIV status of people, but equally, as a person who is HIV positive, it is your responsibility to ensure that you don't just infect people haphazardly. It is criminal. You can be sued for that. Okay. Sawa. But I think we can end the class now. Then we can, any other question, get in touch. Then we'll see what we can continue. Otherwise, thank you so much. I will be sharing the notes after the class. So thank you, and let's meet again next week. Odell, we can end it. Thank you.
Okay.
Yes, thank you.